Hey guys! Today I'm going to be using Manny the Mannequin model to demonstrate the regional terms, directional terms, and body planes, so that when you're referring to parts of yourself or of your friends, you can sound super smart and medical. While I demonstrate the location on Manny, I'm going to give you all of my mnemonics that I use to remember each part, and might help you to remember as well, if you so choose to follow my tricks. Alright, let's begin with the regional terms. First, we've got our head, which is known as the cephalic, which I remember because when some people have syphilis, they go crazy, and cephalic kind of sounds like syphilis. Next, we've got the forehead, which is known as the frontal, which you can remember because it's right where the frontal lobe of the brain is located. Next is the nasal, which I think is pretty self-explanatory. Then we have the eye, which is known as the orbital. You can remember this one because when you roll your eyes, you're kind of orbiting your eye socket, kind of, maybe, sorta. Next is the ear, which is known as the otic. I remember this one because in the movie Milo and Otis, it has a picture of Milo the cat biting Otis the dog's ear. Yeah, this one was just a childhood memory for me. Good luck remembering it. Moving on, we have our cheek, which is known as the buccal, but when I first read it, it looked like buckle, which kind of sounds like butt. And you know what butts have? Cheeks. Next is the mouth, which is known as oral. Again, pretty self-explanatory. Then we have the neck, which is known as the cervical, which I remember because of a cervical neck brace. But if you don't know what that is, then you swerve with your neck, and swervical is like cervical. I got this mnemonic from Rachel Koch. Please don't attack me. A little further down is our chin, known as the mental, which is weird and confusing, but scientists always do that thing where they put their fingers on their chin when they're thinking and trying to look smart, so... Moving on from our head, there's our shoulder, which is known as the acromial, and this is the one term I cannot come up with a mnemonic for, and that's how I remember it, because it just is. Next is our breastbone, which is known as the sternal, which you can remember because the bone is super sturdy and Next is the armpit, which is known as the axillary, which I remember because if you were throwing an axe, you lift up your arm and expose your armpit. But also, if someone handed you the aux cord, you'd be dancing with your arm up, maybe, I guess. Then we have our chest, which is known as the thoracic, which I remember because Thor is always wearing armor across his chest. We have the breast, which is known as the mammary, which you'll recognize if you've ever watched any medical show ever, and they order a mammogram. But also, mamas breastfeed their babies. Down we have the arm as a whole, which is known as the brachial, which I remember because it is the most common bone you hear people breaking. The front elbow is known as the antecubital because if you cross your eyes and flip your head upside down and twist your arm around, your elbow kind of looks like a cube, I guess. Then we have the back elbow, which is known as the olecranial, which I remember because you're trying to use the term for back and the term for elbow, but then realize that it doesn't use either of those terms, and that it's the olecranial. We have the forearm, which is known as the antebrachial because it's the front of the arm. Next is the posterior knee, which is called the popliteal, which I remember because you stick a pop socket on the back of your phone, and it's the back of your knee. Moving down, the calf is known as the sural, which I can remember because after working out, your calves are super sore. Going back up, we have our wrist, which is known as the carpal, and I'm guessing everyone has heard the term carpal tunnel syndrome at least once in their life, so that's the associated term. We have our palm, known as the palmar, which is self-explanatory. The thumb is known as the pollex, because when you're picking flowers, you often get pollen on your thumb. Our fingers and toes are known as digital, which I remember because when someone has extra fingers or toes, they have extra digits. Back down again, the anterior knee is called the patellar because you pat your kneecap when something's funny. Next is our leg overall, which is called the crural, which I remember because you crawl with your legs and it kind of sounds like crural. I don't know, enough for me to remember it. Another Rachel Koch mnemonic. The ankle is known as the tarsal because if you were wearing an anklet, it might have tassels on it. Next is our big toe, which is known as the hallux, and now this one is a bit of a stretch, but if you have halitosis, your breath smells bad, and your feet also smell bad. Zooming back up, the base of the skull is known as the occipital because Occidental College has a huge baseball field. Then we have vertebral, which is known as the spinal, and the two kind of go hand in hand as the spine has vertebrae. The shoulder blade is known as the scapular because when you do shoulder rolls, your shoulder blade is scraping the socket in a sense. There's the entire back, which is known as the dorsum, as that is where the dorsal fin goes on most aquatic mammals. The loin is known as the lumbar, because when you're lifting lumber, you likely use your loin. Between your hips is known as the sacral, which I remember because you know what else is between your hips? Your genitals, which are used for sex. and in some religions it's sacrilegious to have premarital sex. Below that is your thigh, which is known as the femoral, which I remember because in every medical show it was always really bad if they nicked the femoral artery. Down by your feet is the heel, which is known as the calcaneal, which kind of sounds like it has the word heel in it, in a sense. And finally, the sole is called the plantar because you plant your feet on the ground. Moving on to the directional terms. Anterior is the front because you anticipate what's ahead. Posterior is the back because everything is referred to as post blah 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 when it's in the past. Superior is upper because the more superior you are, the higher up in society you are, while inferior is lower or below. Medial refers to closer to the midline, while lateral refers to further away from the midline because later is further away. Intermediate, however, is right in between medial and lateral, therefore right in the middle. The more proximal you are, the closer you are to the point of origin, or within proximity, while the more distal you are is the further away or distant you are from the point of origin. Something that is superficial is external or surface level, like a paper cut or scratch, but something that is deep goes deep beneath the surface, like a stab wound. Now for the body planes. Mid-sagittal cuts the body right down the middle, right between the eyes, which you can remember because in the song You're Gonna Go Far Kid by The Offspring, they sing, hit 'em right between the eyes, and they also have a song called Sagittal. Or maybe they don't. I might have just made that up. Who knows? Parasagittal doesn't cut directly down the middle, but it does cut the body into halves, simply parallel to the long axis. Frontal cuts right down the front. A transverse cut is horizontal through something. And finally, an oblique cut is diagonal to the long axis, which makes sense because when you're working your oblique muscles, you twist your body diagonally. That's all. Thanks for watching. Bye!